So when we're thinking about getting ready for bariatric surgery, I have patients prepare in 3 separate ways. So there's the medical preparation for bariatric surgery, there's nutritional preparation for bariatric surgery, and then there's behavioral preparation for bariatric surgery. And indeed, we even at our clinic provide a checklist almost so that people can sort of see, here's where I'm at, here's some of the things I need to work on, etc. And I think it gives people a really nice, clear, stepwise approach. And it also helps to explain to them what's going to be involved in life after surgery. So let's talk about medical preparation for bariatric surgery. The medical prep really is making sure that you're safe to have essentially an elective procedure. So if you have other medical conditions right now, are they stable? Is your diabetes under good control? Are your blood sugars stable? We recommend a 3-month blood sugar average, for example, of less than 8.5, if not 8%. So we want your blood sugars down. Are your medications stable? Is your blood pressure under good control? If you have sleep apnea, and we actually screen every person for sleep apnea, then we make sure that you're being treated for your sleep apnea. We also want to make sure that if you're on anti-inflammatories, for example, so things like Advil or naproxen or Celebrex or Arthrotec, that you're off those medications for at least 1 month before surgery, because they're hard on the stomach, and if we're going to be operating on the stomach, we want it as healthy as possible. And then in patients who've had a sleeve gastrectomy, they can resume their anti-inflammatories 3 months after surgery. But if you have a bypass, you can't be on anti-inflammatories ever again. So that sometimes determines which surgery we pick. One of the other most important medical pieces for clearance is if you are a smoker, you must be smoke-free for at least 6 months before bariatric surgery. And the reason for that is, 1, smoking's not good for our health, but more importantly, smoke itself actually is a huge irritant to the stomach, and you're going to have a much smaller stomach to begin with, and so smoking itself can actually increase the risk even further of stomach cancers post-bariatric surgery. And then finally, and this is sort of medical, but realistically, we want to make sure people know what they're getting into. We want to make sure, in addition to being medically safe for surgery, that they're medically knowledgeable about the process. So we at our clinic hold an orientation and a question and answer period for all of our patients, but also we recommend that you make a list of questions that you have as you're doing your own research. So we give you reading material to go through. The idea behind this is that this is actually the one procedure, or the one disease, if you will, that you can actually prepare for, that you have months of preparation. Remember, every other time you were diagnosed with something, it was you were one person one day and the next minute you had this disease. And this is not an overnight thing. So we kind of take advantage of that wait time to get you best prepared for the procedure. And then finally, obviously, if you have other diseases, we recommend that those diseases get treated first before you go for bariatric surgery. So for example, if you've been diagnosed with cancer, we recommend, we want to make sure that you're cancer-free for at least 3 years before you go for bariatric surgery. If you have active heart disease, meaning you're having active chest pain or angina or uncontrolled heart rhythms, those things need to be dealt with first before you go for this procedure. So you have to be medically safe to have a surgical procedure per se. And then finally, if you're a woman who's thinking of having kids, The data shows that you should wait 2 years after bariatric surgery before you have kids. So that sometimes affects some women's decisions to go ahead with bariatric surgery. So I have women who, for example, are 35 and they say to me, I don't want to wait till I'm 37 or 38 to have kids. And I say, well, let's talk about having children now, and then you can think about bariatric surgery afterwards. As far as in men, there's no problems with that. So you can have bariatric surgery and then you can get anyone pregnant anytime afterwards. So those are the medical preparations for surgery. And then there's the nutritional preparation for surgery, and that's almost a checklist, so to speak. And it involves foods that you should shy away from, or foods that we ask you to completely avoid, and then things food-wise that you need to gravitate towards. So, for example, there are no carbonated beverages after bariatric surgery. We ask people to completely give up all carbonated beverages before surgery. We ask you to be alcohol-free for at least a month, if not 2 months before surgery. Alcohol after surgery, you have to be really careful. The stomach is very small, and that's where alcohol is typically absorbed, and so people tend to get drunk really quickly. And also there are some concerns about sort of cross alcohol addiction even after surgery. That has to do with how the craving center or the addiction center of the brain works. And so there's a small increased risk, and not a huge one, but a small increased risk of concerns about alcohol misuse and abuse after surgery. So we watch for that and recommend that people avoid alcohol. The third sort of nutritional piece is that we want people to get used to eating meals frequently, because as you can imagine, when your stomach's much smaller, you're not gonna have the opportunity to just eat a big meal. You don't have that kind of, floor space, so to speak. So eating meals spaced out. And then the third piece of that is making sure that you're having a significant amount of protein, and usually we gauge it at about 70 to 100 grams of protein per day, spaced out over all 3 meals. Behaviorally, we want preparation to look essentially in 3 parts. So one of the biggest behavioral things that's very important for people to do is to start tracking their food. Keeping a food diary, knowing how much of their macronutrients they're taking in. So for example, how many grams of protein are you getting? And this is a language that we all need to learn before bariatric surgery, because it's very important after surgery to know how much nutrients you're getting in, so that you can know if you're literally getting enough to fuel your tank. The biggest challenge after bariatric surgery is if people don't get enough protein, they'll actually lose even more significant muscle mass, which can be dangerous long term, because the more muscle mass you lose with weight loss, the more likely you are to have weight regain long term. The second piece to behavioral therapy, or behavioral preparation rather, that we want to make sure people are doing is how you eat. So chewing your food. You're gonna have a much smaller stomach when this is over, so chewing at least 20 times, getting into the habit of chewing food regularly, because that's something that if that becomes a habit beforehand, it's gonna be a lot easier to put in place after surgery. Nothing is more painful than not chewing food enough, swallowing it, and not having sort of the stomach to deal with it, so to speak. Sitting at a table and making sure that you're present for your meals is also very important, because you're not going to have that feedback cues like you used to, where you can put food in the stomach and 20 minutes later you're okay and your brain says you're full. So it's a much quicker process in terms of behavior. And then finally, no eating and drinking at the same time. So if you only have a half a cup or a cup of a stomach to deal with, you can't fill it with any fluid before you're going to fill it with food. So we ask people to make sure that they don't eat and drink at the same time. And then finally, carrying on that front, you need to make sure that you're getting enough fluid. So get a water bottle and carry it with you throughout the day so that you ensure that you're drinking about 2 liters of fluids. It doesn't have to be water, but 2 liters of fluids for sure, so that you're getting enough fluids after surgery. And I tell all my patients who've had surgery, get a water bottle, you fill it up in the morning, you sip it slowly throughout the day until it's empty, you refill it, and then you slip it slowly throughout the rest of the day. And those are the kind of big behavioral preparations that we want to make sure are in place for surgery. The final little details, I think, for surgery are, in addition to getting information, you want to make sure that you have family support, that there's going to be people in your life who know what you're going through, who are sympathetic to that. There's going to be changes to the way family dinners are. We're a culture who eats together, and that's a good thing. And we want to make sure that your family's on board, or your friends or whoever. It doesn't have to be even family, just somebody who's going to be there to help support you through some of these changes. And that's hugely valuable. We also talk about just being emotionally ready for this big change, and understanding the idea that for many of us, food plays a role of comfort, and it's soothing, and it's medicinal, and it's how we grieve and how we celebrate. And that relationship is going to change. And so just being prepared for what's that new relationship going to look like a little bit is always helpful. And that's a conversation that we try at the clinic to have with every patient. One of the biggest advantages that we have found that we do here is we often match you up with someone who has previously had the surgery, who maybe has very similar life interests as you, sort of. So if you're, let's say, a 60-year-old man who owns his own business, who has, 2 kids and a couple grandkids, I'm not going to match you up with a 26-year-old who just had surgery. I'm going to match you up with someone who's probably similar age, similar interests, similar concerns, that sort of thing. We hook you up by email or by telephone. You have a conversation. I have found in the last decade that I've been really focusing on bariatric surgery, the last 18 years or so in obesity medicine, that kind of shared experience really helps, that I can tell people as much as I can about the science and the medical and all those things with bariatric surgery, but when they talk to someone who's like them, who's a year or 2 or 3 or 4 post-surgery, it really takes care of that emotional piece. It often alleviates a lot of their concerns.